Endometrial cancer is on rise, so let's understand why this is happening. What are the risk factors of having an endometrial cancer? Some of the risk factors are directly related to your lifestyle. The first one is high body mass index, known as obesity. So what happens in obese patients is the peripheral fat contains androgens that gets converted into estrogen. This process is known as aromatization. Estrogen directly stimulates the lining of the womb and it overgrows, resulting into cancer. So it is very important to keep a check on your weight and have an active lifestyle to reduce your risk of having an endometrial cancer. The second one is type 2 diabetic mellitus. Patients with diabetes have an insulin resistance. High insulin means high amount of androgens. And again, it follows the same pathway of conversion from androgen to estrogen. So if you have these two things, very important to make sure you correct them. And in addition to this, if you have the other risk factors like a family history of having an endometrial cancer and some non-modifiable risk factors like starting menarche at an early age, having a late menopause, taking HRT medications, having had breast cancer, and hence you are taking tamoxifen, then you are at increased risk of having an endometrial cancer. So now what are the symptoms that you should be looking for? So if you have post-menopausal bleeding, any amount of bleeding, whether it's in the form of a brownish discharge, spotting, or a frank bleeding, you should consult your doctor immediately. What we perform is an ultrasound scan, and we are interested in looking what the endometrial thickness is. So if the endometrial thickness is more than 4 millimeters, it increases the risk of you having an endometrial pre-cancer or a cancer. So watch out for the symptoms and see your specialist on time.